My name's Charlie Foster. I'm an academic at Bristol University. I'm also the chair of the Chief Medical Officer's Physical Activity Committee for the last 4 years, which involves advising the CMOs on physical activity-related matters, and sometimes they listen, and sometimes they don't, which is good. We have an excellent panel today who are going to present some national and international policy and interventions agenda. And we're covering from Sport England, UK Active, the National Centre for Sport and Exercise Medicine, and finally the Daily Mail Foundation. How we're going to do it, because it's a physical activity session, it's going to be brisk. They're going to come up, do their 10 minutes. We may have time for one or two questions of clarification, and then we're going to have some questions at the end. But I will be setting you some homework. So as you hear a presentation, please think of a question you wish to ask the person sitting nearest you. And for some of you at the back, you may have to move to actually make that question. So between each session, one question about what's something that you've struck you about you've learned in that particular session, because I want some questions at the end. Okay, without more ado, I'll introduce our first speaker, Mike Diper, Director of Sport England. Mike's had a measured and huge history, a variety of working with different government agencies, and currently he's going to talk to us about how we're going to lead us towards a more active nation. Mike, the floor is yours. Your 10 minutes starts when you get here.
Good morning. Thanks, Charlie. Great to be with you and be able to update you on our Towards an Active Nation strategy. I'd really want to underline from the outset the importance we attach at Sport England to the partnership with Public Health England and indeed the wider health and physical activity sector. In fact, we can't deliver what I hope are shared ambitions unless we build these partnerships. Just a reminder of the context we work under. It was set by Sporting Future, published December 2015, signalled very significant change. The most important change, that public funding, lottery, exchequer, whatever, comes to sport and physical activity because of the wider benefits, the 5 outcomes you can see on that slide. I hope you've seen this before. It's our vision. It's really easy to say. We want everyone, regardless of their age, background, and ability, to engage in sport and physical activity, but it's not what's happening now. We've got to challenge the status quo, and that's what we're seeking to do. I'll let you read this slide for yourself. It's the really big shifts in policy, in effort, in resource we signalled through our strategy. Just highlight 3 quickly. Customer focus. Make no apologies for putting the customer right at the heart of what we do, meeting their needs, using behavioural change. And what I mean by customer is, yes, people who are already active or fairly active, but much, much more importantly, all of those people who could be active if we get the offer right. And the big shift for us is putting resource and time up from those already with a resilient habit into people who are inactive or have a revolving in and out of activity habit. That's the challenge. Great that 60% plus people are meeting the CMO guidelines. That's fantastic. But what I really worry about, and I hope you worry about, is the almost 26%, 11.3 million people who are inactive, so not doing 30 minutes or more of moderate intensity activity. And our task is to move those people along towards the 150 minutes. And I really want to underline, this is not about making everybody sporty in the traditional sense. If you get over that 30-minute threshold, move towards the 150 simply by brisk walking, that's fine. And when we talk about sport and physical activity, it's a really, really broad definition. It's more than just a numbers game for us, and of course we're not starting just from a blank sheet. We've got the great examples from our Get Healthy, Get Active pilots, 33 projects, and the numbers are really fantastic. What it tells us is you've got to reach an awful lot of people to first be able to target and talk to inactive people. Many people fall by the wayside but actually the return of investment is still good. These pilots are still running, but we've got almost 31,000 transitioned into long-term activity. We've checked after 3 months, after 6 months. And so that, if you divide the 13 million we invested, is something at a cost of £450. That's actually a good rate of return. But as I said, the learning is really important. And these are the 10 principles which we've found from across our pilots. I'm going to look at 1 or 2 of them quickly, starting with understanding inactivity. And now, if we're honest, is this where our mind often goes when we talk about inactive people? Of course, these sorts of people exist. They need our help, and we are helping them. But actually, the stereotype is really misleading. In fact, 37% of the 26% who are inactive, so something like 4 million plus, simply are inactive because they don't reach the intensity level. They're really active people, living busy lives. They don't perceive themselves to be inactive, and would actually be quite insulted. And it's why great campaigns like Public Health England's Active 10 campaign really can talk and help speak to those people. The second area I wanted to look at is using audience insight, reframing the message. And I think our This Girl Can campaign really is a great example of these 2 principles in action. The campaign is driven by insight, the underlying fear. Many women tell us the fear of judgment, why they can't be active at the moment. It also tries to reframe the conversation using everyday images, everyday women in different places, and celebrates what women can do rather than what they can't do. It's not preachy, it's empowering. And we've seen the gender gap, which when we ahead of This Girl Can was something like 2 million people. It's gone down to 1.5 million. Still lots more to do there, but it's a good start, and it shows how you can make a difference. The final principle I'm going to look at quickly today is designing the offer to suit the audience. And possibly the biggest learning we've had from the pilots is if you try and shoehorn people into an existing offer, particularly if that's very traditional, it doesn't work for inactive people. You have to design the offer for them, their needs, and to suit their circumstances. And our partnership with Mind is a great example of that. A programme designed by people with mental health issues for mental health issues. Just round off very quickly with 3 current opportunities of where we could work together. I find this slide really sobering. The fact that the richest people in our society, only 17% of those are inactive, but go down to the poorest, NSET Group 8, and it's almost 40%. I just think that's wrong. It's unfair. It's not right. So the second round of our dedicated inactivity fund, which launched just last week, 6th of September, is seeking to find... I couldn't miss that signal. Seeking to find learning for people on low incomes, everyday people who live very ordered lives but aren't active. So there's some great opportunities there. Our biggest investment over towards an active nation is going to be into our 10 local pilots. These are hot houses where we're going to seek to change at population-wide size. We've shortlisted 19 areas. We're out visiting, talking to them now, and our board will choose the 10 areas in November. Once they're announced, there's going to be lots and lots of opportunities to work together in these areas to really make an impact. And then finally, I wanted to highlight the partnership we have with Public Health England around the Moving Healthcare Professionals programme. It's something like 13% of the population see their GP every 2 weeks. And 1 in 4 of them tell us that they would do something more or start to be more active if their GP or a nurse told them to do so. But most GPs, most nurses aren't able to confidently talk about being active or sometimes even know about the recommended levels of at least getting over 30 minutes, moving towards 150. So this program is seeking to really change that. It's working in 4 pilot areas at the moment, but I'm really confident we'll roll it out to the whole country. 5,000 GPs, nurses and midwives have already benefited from that. That's a whistle-stop tour, an update on Towards an Active Nation. I hope I've stuck to my 10 minutes. I really, really welcome the chance to continue working with you. Thank you.
Any quick questions or clarification for Steve? And I'd like you to react to your neighbour for 1 minute, just quickly, about something you've learned from Steve's presentation while I do a quick changeover. Go. So speak to the person next to you. Say hello. It's a friendly thing. No questions or questions at the end. Good job. Okay, next one down.
Good luck, Mike. I hope it goes well.
Raise the energy. That was brilliant. Thank you. And she came to see you about 6.5 minutes.
Yeah, you did really well there. It was kind of, that was a bit odd.
Well, I've given you more time to overrun.
Yeah. I need it, mate. I need it.
Was it okay, though?
Really good.
Right.
Yeah, really clear. Yeah, really clear.
Interesting and
It's really exciting stuff. I'm so proud of what we're now doing, actually. It's what we needed to do a long time ago. And
Okay, class, attention
really will
please.
make a change.
Good job. Thank you very much. Next up, we have Steve Mann. Steve's going to talk to us about identifying what works for local physical activity interventions. Steve's the research director at UK Active. He's got a long and experienced career working with the health and leisure industry, and he's going to share some of their experiences with us today. Again, think of questions to think about for the end for the panel and reactions to the presentation. Steve, your time starts now.
Thank you ever so much, Charlie. I'm going to try and do this in 8 minutes because I'm terrified of getting that signal coming back around the corner again in a moment. So I'm going to rush through. Well, thank you ever so much for having me here. And in a slight sort of change from the original presentation, we're going to start looking at how it is we start building an evidence base. We start understanding what is going to work in getting more people more active more often, which is our mantra at UK Active. And we try and do this not so much through the direct delivery of programs or through kind of direct interventions, but more by growing the value of physical activity to society. And we do that by working with government, with stakeholders, with partners such as those on the panel here today, and of course many of you in the room. And we focus on both championing the fun of fitness and the exhilaration of movement and things that many of us will enjoy. We have a national celebration on the 27th of September in National Fitness Day, where we're looking to have sort of 10,000 10,000 schools doing 10 minutes of activity at 10 o'clock on that day. We've got all our partners and members opening the doors to leisure centres, to gyms, to create the most active day of the year. But then perhaps more pertinent to this audience and this conference is challenging inactivity wherever it is we can find it, and those alarming statistics that Mike presented. But through my role as the research director, I see my role in kind of increasing the value of physical activity to society in evidence-basing what we can deliver and the impact that we're having. And I think the more we can evidence that impact, the greater leverage we have when channeling investment into our sector and into our programs. So our kind of primary objective really as a research institute is to answer the question, how is it we get more people more active more often? And we've been working on this kind of agenda for 3-4 years now with our kind of partner universities at the bottom there, and you're going to hear a little bit about the work we do with the National Centre for Sport and Exercise Medicine and with Public Health England. But this challenge and this kind of notion and this drive to embed data collection and evidence into physical activity delivery came from off the back of a paper we published in the British Journal of Sports Medicine a couple of years ago, where us as a group, all these universities at the bottom here, suggested that physical activity for health, sport and exercise medicine, whatever it will be, is going to fall into an efficacy gap. We know the theory incredibly well. The physiology exists, hundreds of thousands of research papers. But are we seeing that evidence translating into real-world practice so we can give stakeholders confidence in our delivery mechanisms? And we felt the answer was no. And this came off the back of a report we published with Public Health England and Rob at the National Centre for Sport and Exercise Medicine, where we surveyed 900 physical activity programs across the country. And we asked them to give us detail of the evidence base they had for their delivery, what impact they were having locally. And we graded that evidence base against some pretty rigorous standards of evidence published by Nesta, where they kind of describe the idea that at level 1, you have a coherent idea of why you're delivering your program. At level 2, you have impact pre and post. But at level 3, you then start comparing your current intervention to a control group or a comparison. At level 4, that's independently evaluated. And at level 5, you have scalable mechanisms to prove you can operate at scale against these kind of control conditions. And Public Health England challenged us to find 7 or 8, 9, 10 programs of good established delivery that we know works. So this was around the time Public Health England were producing their Everybody Active Every Day strategy. And we, at the time, wanted to not challenge people to reinvent the wheel every time, to take here some established mechanisms for delivery that we know work. Let's kind of build upon those. But the unfortunate outcome was that we had no programs reach level 4 or level 5 of those standards that we could take back to Public Health England and say, these are the things to hang your hat on. So we then, off the back of this kind of that report, published the editorial and started a huge program of work over the last 2-3 years alongside our colleagues at Sport England, Public Health England, the National Centre, to really start driving evidence into our delivery. And this isn't about proving that physical activity is good for health. That side of it's been done. It was actually about helping people who are delivering anecdotally fantastic interventions, fantastic programs, evidence that to key public health stakeholders. So we saw reports that we published from UK Active, Steps to Solving Inactivity, a blueprint for Inactive Britain. We saw evaluation roadshows funded by Public Health England, delivered by the National Centre for Sport and Exercise Medicine. We went on tour ourselves, advocating around the country with local stakeholders why this is so important, but again, more importantly perhaps, providing practical guidance on how to actually embed data collection and evaluation into programs. And there's a few examples at the bottom there of kind of companies, big organisations, mass physical activity providers who we've kind of embedded ourselves within over the last couple of years to help them understand exactly why this is important and how to do it. So we then thought around this year was time to see if that's had any impact. And we kind of repeat this process, repeat this survey to see if there has been any change in the level of data collection being completed. And it's a really important time for physical activity. We haven't really seen such investment in exercise, activity, tackling inactivity for a long time with the new Sport England strategy, Public Health England strategy in children, the doubling of the pupil sport premium. It's a really important time within our sector, but were we now in a better position to evidence our impact? And in short, we think we've made some pretty good progress. You can see in the graphic here on the sort of left-hand side, in the first iteration of this survey, we had a huge amount of people we kind of ranked at level 1 of those standards. They knew why they were delivering a program. There was a good kind of rationale for it, but actually had no way of going beyond, we saw 50 people, or we engaged with 25% inactive and 30% active and elsewhere. Actually, there was no pre and post data to show the impact they were having upon whether it be health metrics, psychological outcomes, or even activity levels. And we've seen that dramatically reduce over the last couple of years, and a huge increase of those now reaching level 2, where we're starting to see data collection embedded within delivery. And back to, I suppose, what was the real takeaway point of the first process, was we had no programs above level 3. We only had 2 that kind of had control groups embedded within their delivery. And we've now seen that go up to 18 this time round. So some big national programs that perhaps historically felt it wasn't too important to evaluate and research to this kind of level are now seeing increased challenge around funding, increased challenging from other stakeholders to see, in times of austerity, is this really where we should be putting our money, and are now completing far more rigorous evaluations. But something we probably didn't really focus enough on the first time round in doing this was who should be doing what. Because actually it's not everyone should be engaging with universities, not everyone should be having control groups embedded within their programs. And actually it's really great to see, and I encourage everybody to read Sport England's new evaluation framework, where they've actually taken and built upon our original work to start providing some direction for people as to who should be doing what. And if, for example, you're running a program with a really strong evidence base behind it, we know from previous research that this kind of works and is well established, and there's no real stakeholder desire to see any kind of rigorous research or evaluation go into it, then absolutely sort of level 1 and 2 is appropriate. However, if you are creating new programs, new initiatives, then Sport England are going to demand to see some efficacy research of why this is going to be good in the future and why they should be funding and scaling these interventions. So it's a fantastic tool to help in this process, but also I think shows the sort of unity amongst the kind of stakeholder groups we have in the room in pushing this message forward. But there comes some pragmatic realities with all kind of research and evaluation, and I think this is probably where this report we're going to publish next month is now focused. It's less of a rigorous, let's hold the sector to account, what are we doing? But more, how can we do this more effectively? What are the pragmatic realities that we've seen over the last 2 years when people have tried to implement these designs that we're suggesting, and what they found? So we've seen, for example, from Sport England, who have now covered off really comprehensively what level of evaluation people should be working towards. And again, I'd encourage you to have a look at that website around how it is you put an external evaluation process in place. There's some great kind of literature there, really important for how you engage with the universities, when it becomes important, or other kind of research agencies. But this, thank you very much, this control group is really important. And this was kind of the big bone of contention, is that, you know, why should we be withholding interventions from people when we could be channeling all our money into something that we know works in physical activity? And there's a brilliant case study in the report coming up where we look at a group who tried to implement a kind of 4-arm randomized control trial, really rigorous. And then we have a professor kind of commentating along the side of what actually happened. And in reality, no one was randomizing anything, no control groups were being kind of delivered, data collection was failing. And all of a sudden we start to understand how difficult these things are to actually implement, and why it's so important to start engaging early with researchers and to design things pragmatically with the end user in mind. But we also see some brilliant examples of where a control group doesn't have to mean no intervention at all. And if we look back at this kind of on the right-hand side, it's not about proving that activity and exercise works. It's about proving that this new innovative delivery model is better than the traditional. And actually, we see some great examples of how people are building and using research to grow and develop their activity offering. And also, utilising wait lists where possible. We've seen in some of the research that I've conducted, a school program that's going to be rolled out over 2 years. Well, that's an ideal opportunity to, in the first year, have a kind of waitlist control condition that we can start to prove whether or not this school-based program is having an impact, and I suppose more importantly, learn from what is discussed, is revealed in the data to help inform delivery next time round. So in terms of what's coming next, this kind of promising practice, this kind of driving evaluation data into the sector is an ongoing piece of work for us, and we're going to kind of continue to build networks and develop an interface between academia and pragmatic delivery. And I'm being told to wrap up, so I'll do that there. But the slides are available in PDF, so it's probably worth reading the last little bits. Thanks so much. No, I have to rely on that.
We've scared away the timekeeping watchdog. Okay, I'd like you to stand this time and talk to your neighbour, please, because breaking up your sedentary behaviour is one of the key elements of the CMO recommendations. Go. Yeah, I said he was too well behaved because you didn't. That's
why I got over.
Oh, no, you can't. It's much better for them to talk to each other than us.
Yeah, perfect.
Happy? I'm going to do a really rapid introduction. Okay, time please. Thank you very much. You can have a sit down if you want to relax. You can remain standing too if you feel like it. Our next speaker is Professor Rob Copeland. Rob will be speaking about moving more and identifying Sheffield, showcasing a whole systems approach to increasing physical activity. Rob's Professor of Physical Activity and Health up at the Sheffield Hallam University. He's also a member of the CMO committee working with us on muscular strength and balance training at the moment, so I know Rob very well. He always is very thoughtful and very challenging and is desperately keen to do something about the problem. Rob.
Thanks. Morning, everyone. Thanks for the invitation to be here. I know that my presentation is about 12 minutes, so I'm going to have to speak really quickly, otherwise the crook will be pulled and I'll disappear off this side here. So I'm going to talk about whole systems approach, and you'll see in the title there's a question mark at the end. That's not a typo. There might be other typos which are not intentional, but that one is intentional. And that's because we don't necessarily have this cracked in Sheffield. I'm not here telling you we've got it sorted. But actually what I'd rather do is just share what we've been up to over the last few years through the National Centre for Sport and Exercise Medicine. And that's where the journey started for us, really. The National Centre, a London 2012 Olympic legacy commitment with a vision to improve the health and well-being of the nation through sport, exercise and physical activity was really the catalyst for our work. And if you want to understand a little bit more about the National Centre, go to ncsem.org.uk after this and have a look at some of the programmes that we've been doing across our 3 centres in London, East Midlands, and then the best one up in Sheffield. So before I head into this, I thought we'd take a bit of a step back, because if you're like me, you will have probably spent quite a lot of time talking and reading and listening to this idea about whole systems approaches. But I've not seen a great deal of stuff on actually how you do it. And this is why I really like this statement from Peter Sassis and colleagues and their work on integrated care, who suggests that actually there's no real roadmap or magic bullet. The person in the corridor next door hasn't got it sorted. But instead it's about trying to identify and make connections across a whole range of different organisations. It's about understanding how we behave, and then it's looking for opportunities to change the culture in amongst those connections. Or to put it another way, let's think about the problem of inactivity in Sheffield like a balloon. And I've stolen this from a colleague of mine, Nick Cavell. And Nick says, what we often do is we kind of prod and poke this balloon in different directions. And we then, as a result, have short-term and largely individual level impact. And instead what we need to do is be connected in the way that we squeeze this balloon from all sides in order to have population level impact. And if we look at the diagram on the right-hand side there, what we're trying to achieve, in my view, around systems is a move from a disordered and confused perspective on physical activity, where often interventions in a place are delivered randomly, to a much more coordinated and collaborative approach to our delivery of physical activity that has collective impact. And if we could look inside that balloon, I think this is probably what we would see. This is the sociological model developed by James Sallis and colleagues over a decade ago now that focused specifically on physical activity. And this model sets out the different elements of the system that influence people's physical activity. Sallis suggests there are 4 domains: household, occupation, travel, and recreation, where we are physically active. And our behaviour within these domains is influenced by our individual differences and experiences, by our physical, social, informational, and physical environment, and also the policy context within which we operate. So our challenge then, in my view, is to connect all these different aspects, understand how they behave as a system, and ultimately then find opportunities and connections to have a population level impact. So that's what we did in Sheffield, and it's not rocket science. We took this model and we looked across our city and we said, who has influence over those different areas of that sociological model? And we invited them to the City Hall because it's a nice venue, and we put on lunch because we know that that gets people in a room. And we had over 300 delegates from across 80 different organisations from each element of the system: local communities, town planners, directors of public health, NHS financial accountants. I kid you not, they did turn up. And we had a couple of academics thrown in there as well. And we asked people to tell us, using an asset-based approach, what was working well in Sheffield. Where were the assets? What were the strengths of our place? rather than simply asking people what was wrong. And then what we did is we formed a board, a coalition of the willing, if you like, from the key organisations, 12 organisations across the city that we know could influence the city and also had some budget, including the local authority and the CCG. We had Sir Andrew Cash, who's the chair of the teaching hospitals, who chaired our board. And the board signed up to a shared vision that was produced during that event at the City Hall. And this is the vision in Sheffield. It's got two aspects to it. The first one is this, to create the right culture. And that's absolutely crucial because in order to influence systems, you need to have the right culture. You need to have an appropriate mindset and an agreed set of values. And this is particularly important in terms of how you view success. And we see success in Sheffield as an evolving learning process. We're not getting it right all the time. It's not a mechanistic series of pragmatic steps that shift us towards population level change. It will be an iterative approach. And the second thing is we needed to have a time on this, and it needed to be focused on population, hence the most active city in the UK by 2020. Our mindset for this was about keeping it really simple and looking across our system to say, how can we make it easier for everyone in Sheffield to be physically active as part of everyday life? And to do that, we need to have a culture whereby we're open and willing to do things differently, to perhaps listen to those communities more readily. And Mike in his talk has talked about the importance of insight and designing interventions for people. And we really take that on. But that requires a lot of trust. It requires giving ownership over to others. And importantly, you need to work, in our view, in a climate where people seek to give away ownership rather than acquire credit. And very often that's a real challenge. But we think that can help break down organisational barriers and silos. We co-produced this plan, so everything in Sheffield is now yellow. And this is called the Move More plan. You can go to movemoresheffield.com and download and have a look at this. And this sets out how we plan to make connections across the system, but also identifies some of the programmes and projects that we would like to undertake to transform Sheffield into the most active city. And if there's time, I'll give you an example of one of those later on. This is our governance model. I'm sure it's very similar to the ones in your place. But I think importantly, just to draw your attention to the connection between the board, the system leaders and the major organisations, and our communities. The board each member of the board is a sponsor for one of our areas of work so that we can connect our community leaders with our board leaders. So we have good connection across the system, in theory. So we went through this process a few years ago, and I think that shifted us from a place of disorder and confusion towards this idea about collective impact. We were operating under a shared vision, and we had much better understanding as a result of getting everyone together as to where connections were across our physical activity landscape in Sheffield. And we think these are some of the key elements in terms of delivering a whole systems approach. But we weren't there yet. We were still had a bit to do on the journey. So what do we do next? Well, we've continued to try and better connect our city and to develop insight into the different aspects of how the system behaves. And one opportunity that's enabled us to do this is the combination of health and social care, the integration of those services. And in Sheffield, that's manifested in something called the People Keeping Well programme. And that identifies 19 areas across the city that are defined by community partnerships. And these community partnerships are not defined by geography or artificial boundaries, but they're defined by how people access services and the community services that deliver to that area. And it means they're more representative of how people actually live their lives. And strategically, as a board, we've said we will focus on the 10 people keeping well areas where we know the least active in our population exist. And then what we've tried to do is what we call reduce our serendipity index. And what I mean is that often in these programs, in these areas, there are multiple physical activity interventions, whether that's through older people, whether it's park runs, whether it's leisure centre-based, that exist within an area but are not connected other than through individual conversations or serendipity. And so what we've tried to do is bring those programs together so that they are aware of one another, they can have a shared vision for that place, a shared set of outcomes framework to measure impact, they can share resources, and ultimately in that area they can have collective rather than individual impact. And our intention is to scale that up across our people keeping well areas so that we can deliver it at the macro level and not just the micro level. How are we doing? Have I got a couple of minutes? Okay, so good, that's the right answer, brilliant. So let me give one example of what we're able to do as a result of this sort of working across the system. The best available evidence around physical activity intervention suggests that what we need to do is think about utilising mass media, social media, getting large numbers of people together in communities to promote physical activity. And so we came up with this concept of the Move More Challenge, whereby for 1 month, everyone in the city will be invited to be part of something bigger than themselves. And the idea was to introduce people to the vision of Sheffield being the most active city, but to connect communities together in terms of physical activity. We developed an app so that people could monitor their own physical activity called the Move More app. And this really is sort of the heartbeat of the Move More Challenge. This has also been the engine behind the One New Active 10 campaign. So do download the app, have a look at it and let us know what you think. We did some work in schools with near-field communications tech, where we used physical activity as part of the curriculum to challenge kids to be more physically active. And my personal favourite, the Steel City Derby, where we got the football clubs to pitch their fans against one another. So we had Sheffield Wednesday fans against Sheffield United fans to see which was the most active football club. And then finally what we did is we worked with our community partners across these 19 People Keeping Well areas and got together a programme of over 400 different physical activity opportunities that people could engage with, connected under a single brand with Move More. And then finally a workplace challenge where we used physical activity to gamify and to draw people together in the workplace. And what was encouraging about this element of is that we know that it engaged and activated the least active. So this is using the single item physical activity questionnaire. And this is what happens when you activate a whole city. So we did it in 2016. We had 6.5 million minutes of movement collectively as a city. This year we managed 8.3 million. We engaged just over 10,000 people from across Sheffield. And there is no way that we could do that had we not had the level of connections across the physical activity system. And our intention is to grow and to build this as we move forward. Where does that leave us as a city? Well, if you take the active people survey, the latest data, I know we've moved to active lives, but we're in the first one of that. It seems to suggest that our target audience, the least active, we're moving in the right direction compared to when we started this journey back in London 2012. So there's more to do, but that's our journey in Sheffield in terms of trying to connect the system around physical activity. Thank you.
Excellent. Please resume your seats and your conversations and react to Rob's excellent presentation there about what we actually do. So up you get. We will quick change over before we get Elaine on. It's like, oh, I remember that.
That's absolutely the case.
Oh dear. It's very good.
Oh yeah, absolutely. It's all about engagement.
Absolutely, no.
Nice
And
big
it's
audience, isn't it?
a big audience, and it's fabulous. I've been wanting to have a chat to you for a long time, so it's really nice to get a chance to kind of finally meet, because the Daily Mile is just phenomenal.
It's surprised us all.
That's great, but you did something about the problem, which is what I'm going to say now. I'm sure you're going to say the same thing. Okay, time. Thank you very much, everybody. Okay, our last and final speaker before we open the floor to you for your intelligent and penetrating questions is Elaine Wiley, who's going to talk about the Daily Mile, which is a true phenomenon. It's a problem that was in need of a solution, and Elaine is the person to tell us how she made it happen. Elaine, the floor is yours.
Thank you, Charlie, and thank you for not pronouncing my name as Elaine Willie, because that does sometimes happen to me. So thank you very much for that. The Daily Mile, February 2012, I was head teacher of St Ninian's Primary School and Nursery class in Stirling, 420 children. And One of the volunteers was watching an active assembly one day and said, "Elaine, the children are not fit." So I checked it out with the PE teacher and she said, "Aye, right, they're not fit. Most of them are exhausted by the warm-up in PE." So retrofitting some improvement science here, I didn't know what improvement science was, but if we retrofit it to test 1, the next day I took a year 5 class out to see if they could run around the school field, and it was a shocker. They were doubled up, exhausted, by the far end of the field. And this is critical, and looking back, the children saw the problem for themselves. They knew it. And so we had to sit down and test 2. We just worked up the idea that they would try running around the field for 50 minutes every day for 4 weeks and see what happened. And I didn't really think that very much would happen. However, after 4 weeks, the children in that class were fitter, they were stronger, they were in better fetal, individual, challenging behaviour, and general behaviour had improved, and nobody wanted to stop. They were enjoying it. So in the 15 minutes, it turned out that they were averaging a mile, and naturally, the daily 15 minutes became the daily mile, although it's really the daily 15 minutes. And then what happened next was that demand from parents and staff of other children, other classes, people wanted to do it with their children. So they did. And by the summer, the whole school, and by the autumn, the nursery class were all doing the daily mile. And test 3 is still ongoing. It's still going strong in St Ninians. And now it got out there 2 years ago. There are 3,000 plus schools, 700 in Holland alone, across 30 countries doing the daily mile. It's surprised us all. So no child runs a mile or has to run a mile. They own it, they do their own thing. But in the 15 minutes that they get, this is how far they run. 75% of the younger children do a mile or more, 90% of the older children. So some of them are doing just over 6-minute miles. Some of them are doing 2 miles a day. Early research, Stirling in Edinburgh, about to publish. I'm reassured. We don't have the full details, but things are looking good. And 2015, they measured the children in St Ninians. Our demographic, I'm going to go back here, our demographic is the same as Scotland as a whole. 35% of our children live in the poorest 3 deciles. So in Scotland, 20% of girls aged 8 to 11 are obese, 13% in St Ninians after 3.5 years of running. Boys, 17% in Scotland, 13% in St Ninians. And the younger children, 13% down to 8% in St Ninians, and the boys down to 7%. A lot more work to be done, it's complex, but people are very excited about this. Core principles of the Daily Mile, what is it? Every child, every day. And in wonderful Wigan and wonderful Wales, it's the 2-year-olds as well, they do a daily toddle. We started with the 3-year-olds. I'm going to go and see those toddlers toddling. Fantastic. It works because the children love it. If they didn't like it, it wouldn't work. You couldn't sustain it. It's health and well-being. It's not sport and it's not PE. But fantastically, it's introducing children to sport and PE in a way that they've not been before. And we're getting a lot of reports of children taking up running and other sports because they're healthy and well from the Daily Mile. It's not competitive by nature, but some choose to compete, and that's okay. It's for everybody. And they usually compete by setting themselves up a wee target. I'm going to do another lap today. Always a time, never a distance. They run or jog for 50 minutes, and sometimes they walk. And teachers generally encourage them and know when to sort of crack the whip a bit and gently encourage where necessary. Outdoors in the fresh air in almost all weathers. I would say that, I'm from Scotland, but, we do have some weather. I was expecting a storm last night here, but I didn't see it. I don't know. Maybe there was one through the night. But, almost all weathers. And best at a time of the teacher's choosing, they run in their ordinary school clothes, and, if they've got trainers, that's great. Some lovely pictures. I'll just go through these pretty quickly. That was Hackney. This is Glasgow and World Book Day somewhere. That's a nursery. That's London. And that's an interesting one. Priory School in Slough, where the PE coordinator, Lee Molland, has 900 children daily getting out of breath doing the Daily Mile. So looking back, we removed the barriers to participation in physical activity in school. No kit. We didn't think this through to start with. It just happened. Therefore, none of the negative things around kit, lost kit, smelly kit, missing kit, no time spent changing, really slick transitions, no body image issues or undressing in front of other people. No sense of failure. Every child, whatever their age, ability or circumstances, feels that they succeed at their daily mile. They own it themselves. No equipment, no setup, no tidy up, no warm up. Completely simple. Risk assess it, it's easy. And staff confidence, no special training needed. The teachers know how to do it, the children know how to run, they both know how to go outside the classroom and run around the field. So, benefits for children, there are many. That habit forming, and we're seeing now that children from St Ninians have been running for 5.5 years, going to high school, and they need to run. And they think it's normal and natural, and that's an amazing thing. 4 weeks they get fit, and then they get fitter. We've got evidence for these claims. I'm just cracking on because it's I don't want the sign. Impact on obesity, and we have to look at that more carefully. We've got evidence, clear evidence for raised attainment and quite dramatic raised attainment. 20-25% in maths and reading in a school in London. You can look that up. Copper Mile report. This is huge, absolutely huge. We have a mental health crisis and the children are happy. And one head teacher came to speak to another group of head teachers. I don't know what she was going to say. And she said, I'm going to talk about the children's happiness because of the Daily Mile. Resilience, no learned helplessness. Children actually taking responsibility. It's their health. They're taking responsibility for it and they know it. And that's really, really important. Intrinsic motivation to look after yourself. So resilience, self-esteem is built, determination. Physical literacy. Children learn to read by reading, write by writing. They learn to run and be physically literate by running. And they know they're healthier and they know they've got a healthy body and they start to think about it and look after it and sort of say to their parents, and we hear about this, is this good for me? Should I be eating this? Just things like that. And I thought it was a fantastic keynote this morning. It really touched me. And the Daily Mile closes the gap. These poor kids, who 25% of our families have no money, special needs. So children with mobility difficulties, children with special educational needs, complex needs, take part routinely. It's quite amazing. Children with autistic spectrum disorder can go out and be, let their emotions go outside, on a familiar path. Children with quite serious conditions who've never run before. I've seen them. I've seen a boy with brittle bones actually doing the Daily Mile in Barnsley. Socialisation opportunities for children who play alongside others normally and not with them. And I'm going to show you a picture that illustrates that. And this is a school in Leatherhead. And these children have complex needs. And 90% of them are non-verbal. Their parents and teachers asked me to share this with you. And that's what they look like after they've done their Daily Mile. And children with special needs in mainstream take part as well. But this is critical. We're asking schools and nurseries to implement it. Why does it work in schools and nurseries? It's totally simple. It costs nothing. We didn't have any money when we had this, looking back on that, we didn't have any money to spend. It's totally free. It's a practical health and wellbeing solution, not just a message. It impacts on behaviour really positively, challenging behaviour in individuals. I've spoken about raising attainment. Teachers like it, and learning assistants, and it works well for their health and well-being as well, and it makes changes. A head teacher got in touch from Morecambe Bay to say she'd lost 3 stones in a year running with her reception class. So good on her. Parents love it, and let me tell you, schools like it when parents love things. There are new government requirements for physical activity. That's my favourite line. As a teacher, no planning, measurement, assessment, nothing. And this is my next favourite, no workload for teachers or schools, and that's vital. The last thing the schools and teachers need is workload. Language of friendship used around the path by children and teachers supporting each other. And it enables industrial quantities of children to be active every day. I'm nearly finished. Just some pictures. Some girls in Glasgow, these are 11 and 12-year-old girls actually running. It's true. These are children in Wigan. Look at that lovely space they've got to run. Why do they love it? Why do children love the day? Do you know the work of Sue Palmer on childhood? Some of you might. Okay, I'm going to ask you a question. Think of a memory from your childhood when you were playing and you were happy. And don't tell anyone what it is. I'm going to give you 10 seconds just to come up with that memory. Okay, thinking of your memory, I want you to answer 3 questions. When you were playing and you were happy in this memory, were you indoors or outdoors? Were you on your own or with others? And were there adults organising you and telling you what to do? No. That's right. And that's childhood. And I think this is why the Daily Mile works. Fresh air, friends, fun, and a sense of freedom. And it meets those needs of childhood. And that's why children like it, and that's why we can keep doing it, because they like it. They enjoy it. It's for them all. And my last slide, very quickly, it's dead simple. It is a no-brainer. Quick, visible, medium, long-term wins, very, very visible, parents, staff, children. The time is right, we need to do something. A lot of fantastic support from people across local and national government, public health and education. Parents drive it. School sports partnerships have been fantastic, and PE coordinators making a difference for children. The foundation, which pays my expenses and John's expenses to get us around the country, and the website and social media, lots of use of Twitter and stuff, and scalable to a school cohort, a local authority, a city cohort, a national cohort, and it's free. And I'm going to leave you with just one lovely picture at the end. Isn't that lovely? Thanks very much.
Thank you very much, Elaine. Inspiring stuff. Okay, you've got 30 seconds in your pairs to generate a question for the panel. Go. Okay. Microphone people, if you could just get yourself ready.
Yeah. Do you fancy doing it?
You need to try up a bit, I think. You're in a position to talk to
I've got one.
I mean, there is, you can film
may
it,
need
but
to-
it can be done better.
I don't know, we have to see how it goes because there are sometimes we've got we've done an insert.
Excellent. We have 6 minutes. If you want to ask a question, start waving now. Excellent. Gentleman over there, first up, hands up. Okay, please say who you are, where you're from, and direct your question at this excellent panel. Go.
Piers Simey from Hertfordshire Public Health. Question for Rob. Really inspiring overview around whole systems. We're all talking around whole systems work. Can you give us any sense of the lead-in between some conversations to how long did it take from those conversations with people that are up for it into this great big delegate gathering?
Okay, so from the, it was pretty quick to be honest. It was probably too quick because it was just a horrible thing to get sorted by the time you've organised the plasticine and the pipe cleaners for the asset-based stuff. You're probably talking 3 to 6 months from the initial conversations to getting beyond the event and the sort of the forming and storming. So that's about 6 months. But then to take that to then a meaningful culture, we've been, what are we now, 5 years?
Thanks, Piers. Great question. Over here at the front. Thank you.
Hello, Liz Brutus, Department for Work and Pensions. A very quick aside, Elaine, thanks so much for your very touching but an inspiring presentation. I think it's a message for all of us. My question really is about any of the panel in how successful have they found engagement with Job Centre Plus as a way in, particularly to the unemployed?
Yeah. Can I kick that off? I mean, this is where I think the model that we're trying to grow in Sheffield is really, really helpful. So we've got a program called Walking for Purpose, And we connect with our, in one of our communities. It's not ubiquitous across the patch, but it's in one of our communities in the South People Keeping Well area. And they connected the volunteer-led health walk program with the Job Centre Plus, and they meet people who are unemployed, socially isolated, in that community, and they take them for a walk. And at the same time, they've got people there that teach them about, writing CVs. They've got someone there from the passenger transport executive that tells them they can access free public transport to get them to job interviews and back again. And that meets at the local leisure centre where there's a brew, a loo and something to do, which is kind of what we like to say in Sheffield. And so that connection of those bits work really well. And so we've seen some people get jobs, but that's in like the 2s and 3s, maybe 4 as a result of this. But the growth in those individuals in terms of their likelihood to be socially engaged, to have increases in their self-efficacy over the next months and years are more likely, we think, to then be employable and perhaps more importantly view themselves as being employable.
Thanks, Rob. Next question. Hope it's not for Rob.
Sorry.
Andrew Marsh, University of Warwick. Question for Elaine and Rob. What evidence do you have that engagement with physical activity was driving behaviour change in other areas, for example, healthier diet and eating better, basically?
We only have anecdotal evidence for that at the moment. There are many studies taking place around the Daily Mile across the country, and things like that will be looked at. But it was anecdotal evidence from parents and teachers.
My question, my name is Karen Hearn from Northumberland Local Authority, who commissioned the 0 to 19 service, and it's about the Daily Mile again. Really inspiring what you had to say, and it was great to hear about those children who have been doing it for so long. And my question is, how is it working in the secondary schools? Because we find in the primary schools they're all up for physical activities, and then the children transition up to secondary school and academia tends to take over. So I'd be really keen to find if there's any experience you have with secondary school participation in the Daily Mile type of activities.
Can you wave your hand? I can't see. Oh, you're right there. Hello. And sorry I got a wee bit emotional at that. I never ever do that, but it just kind of caught me with what the professor said this morning. Yes, secondaries are going to be a harder nut to crack, and the Scottish Government have written to all nurseries, primary schools and secondaries and universities, and St Andrews University has got a Daily Mile officer. They've written to them asking them to do the Daily Mile, look at the evidence. The Chief Medical Officer, the Deputy First Minister and the Minister of Public Health wrote to them, and workplaces as well. So we're just hoping there are a handful of Scottish schools and a handful nationally, and we need the young people and the teachers to come up with a solution for that one, to make it's so simple in primary. We need a solution for secondary.
Just on that incredibly briefly, we know from secondary schools that just getting out to walk a mile or run a mile is going to be challenging, but moving them away from traditional sports is something that children are indicating they definitely want to be doing, and moving for fun, not moving to learn a very structured activity. And I think that's going to be key when we build that answer around what children are looking for.
Right, time for 2 more questions. Yes.
I'm Meriden Peach. I'm the Director of Public Health at the London Borough of Newham. Really inspiring presentations, thanks. Really helpful, because I sit in a patch where we've had the Olympics on the patch and we have one of the lowest rates of physical activity in the country. So having the Olympics on the patch doesn't always work. My question is, I didn't hear a lot about, you talked a bit about sustainability and how you maintain it. What potentially is the role of teams and organised physical activity or organised sport in terms of helping create sustainability? I'd just be interested in that question.
Let me pick up on that first. In terms of sustainability, one of the really interesting things from our Get Healthy, Get Active programs, which are still running, we're seeing the solution being picked up and funded locally far more than in many of our funding programs. So that might be the local CCG putting some money into it, could be the Health and Wellbeing Board, could actually just be individuals putting their own income into doing that. So there's some lessons to be learned from there. I think when it comes to looking at trends, there are lots where the growth is coming. It's in very informal, simple, easy to do things. So walking, running, going swimming, maybe cycling, things like that. I think there is always going to be an important part for clubs and team sports for people who want that. Again, it comes back to not trying to hone everybody into that traditional thing. So we're not seeing the number of clubs drop or the number of team sports participants dramatically drop. It needs to be part of the solution. I'm not sure if it's always the solution for the most inactive.
Thanks, Charlie. Diplomatic as always, really. Thank you. Question for Mike Green, and it's a joint question really from us both, really, is does Sport England operate and work across NHS arm's length bodies? You mentioned an awful lot about Public Health England, etc. Fantastic, really, but areas such as the Care Quality Commission. And beyond that, I'm thinking of schools again in terms of Ofsted, really. So it's great to say we've got these things. Who's actually going along to say, actually, how can we check, not regulate that bit? I know they are regulators, but actually check and support you to do it.
Yeah, sure. Let's start with the partnerships bit. It's not just working with Public Health England. We're increasingly working with CCGs, crime commissioners, people like that. We really actually want to reach out and work with partners who we haven't. And our latest funding around inactivity, active ageing, we haven't announced the programmes yet, but well over a half are with organisations, groups, local, national, we've never worked with before, and that's really important. Accountability, I think particularly in the school sector, there is much more Ofsted could do to help us. I'm actually missing a ministerial board which is looking at the accountability today of how the primary premium is used. Some schools use that brilliantly, some just buy a minibus or put a climbing frame up. I think there has to be more accountability. It's something we're pushing for. It's a hard task, though.
Okay, I'm going to call time. You know what this lot looked like. They've done a fantastic job today. Let's sort of say thank you again to them. Thank you. Okay, thanks to Mike, to Steve, and to Rob and to Elaine for threading together an excellent session. Thank you to you, the audience, for some great questions, and thank you to the conference folk for making it run so smoothly. It's time for coffee. Next session starts at 11:10. Thank you very much.